It has been estimated that as many as 1 in 7 children and adolescents will deal with a mental health issue this year. And getting help is vital, but it can also be daunting.
CBS 2's Cindy Hsu spoke with experts and survivors in this critical field and shares their stories of hope and guidance.
Almost 11 years later, I still miss her. I still cry.
The tears that Dion Monsanto sheds are for her daughter Seaway, who took her own life at just 15. Monsanto is now an advocate for suicide prevention and helps others navigate the scary and confusing labyrinth of teen mental health care, never forgetting her own experience.
When they're like, okay, you know, she can come home, and I'm like, no. What do I do? Like, you're sending her home again. We've gone through this a few times. She's been hospitalized. What am I doing different? I need help. I need help.
The challenge of finding the right resources for children with mental health struggles is not unique to Monsanto.
Sometimes we don't have an immediate bed available when a family calls in, but what we do is we connect with other local providers.
Kelly Kosinski is with Newport Academy, a Connecticut mental health treatment center for teens.
The reality is yeah, there's a shortage of facilities. I give a lot of credit to the local emergency rooms, crisis centers for facilitating as quickly as possible.
The emergency room is not only a realistic but a viable option if you have none, right? Any of us faced with a crisis want to call 911. It's the easiest and then the best thing to do.
Dr. Sanam Hafiz is a neuropsychologist who says in times of intense need, the ER can make a critical difference, but it doesn't offer care that teenagers need on an ongoing basis.
I just wanted to get back to a place where I wasn't laying on the ground crying in my closet.
Akia Red is a mental health advocate and author who suffered anxiety and eating disorders as a teen. According to the Centers for Disease Control, 1 in 3 high school students reported feelings of sadness or hopelessness in 2019, a 40% increase since 2009.
I also think that in communities that are underserved and marginalized, I think that accessibility to those resources that are available is very limited because, let's be honest, it's very expensive.
There is a lot of funding available, but it's not making its way to the right people. Sometimes smaller practices, single practitioners can do a lot of good work, but they are hindered by resources, lack of funds.
A bill sponsored by the New York State Legislature is seeking to expand the number of mental health practitioners and therapists in developing and implementing assessment-based treatment plans, giving more experts the ability to diagnose and expedite care. Experts say families may be able to negotiate lower costs by calling health providers or insurance companies, and all agree recognizing the signs of trouble is key to early intervention. They include changes in diet, changes in sleep, changes in social patterns, like losing interest in friends or sports, and changes at school.
All the little things make a difference. I feel like we're going to turn the tide and keep talking until there's a plethora of support instead of lack.
Cindy Hsu, CBS 2 News.
Today is Mental Health Action Day, and as we continue to raise awareness, we do want you to know that we have a list of resources on our website. You can find the full list at cbsnewyork.com.